Right. Hi, everyone. I'm Dr. Yemi Adekunte. I'm a consultant psychiatrist and I'm a lecturer at Cambridge University. I think Lisa should be somewhere around there to present part of the data, but we're just looking closely into the data we've collected to make sense of some of the things we've had. So I will leave Lisa to talk more about this data, and if there's any other time, I can spend a bit about 1 or 2 minutes to look more into the text messages that we've received. So Lisa, you can carry on.
Hello, good evening. Can everybody hear me?
Yes.
Yeah. My name is Dr. Mona Lisa Kwentoh. I am consultant psychiatrist working in Eskom Wear Valley, and I will just spend the next 10 minutes looking at the survey. Can everybody see the slides?
Yes, we can.
Yeah, okay. All right. So I'll just go quickly through the slides. Why did we do this survey? I think many people have talked about the differential experience, given that the BAME group is a wide group made up of different ethnic groups, and research that have suggested differential experiences between different members of the ethnic group that make up the wide group known as BAME. The first slide shows that, difference in payment between if you're Black British compared to when you are mixed. The next slide shows like Black staff are underrepresented in senior management roles. And there is another paper that has been recently released called Corporate Gaslighting, which shows differential experiences between application process up to recruitment for people who from different ethnic groups, but showed like a differential experience if you were Black when compared to other members of the ethnic group. When you look at experiences for people who are from the Black community, there's very few in the press as well, but this is also an article of people detailing their experience. Why was a survey done for psychiatrists? It was done for psychiatrists because there isn't much out there about psychiatrists who and what is known about their experiences. What we have is mostly reported within the BAME bracket. Now, the survey was a semi-structured self-report questionnaire. It was an open invitation to everybody in terms of the Association of Black Psychiatrists, but it was also made open to the peer groups and any network of anybody who was considered themselves a Black psychiatrist. They were open to completing the semi-structured self-report questionnaire. It ran for about 6 months. In terms of the number, the grades of people who completed the survey, there were consultants, SAS doctors, trainees. You can see it's almost like an equal split, and people who were in other roles. There was also an equal gender split, 50.5 to 49.5% in terms of the genders who responded. What did we find? There were specific questions asked about bullying, harassment, microaggression, and othering. But what we've done is kind of done a summary of some of the responses to be able to fit into the time that has been given for the presentation. 44% of respondents had reported experiencing bullying in the workplace. 61% of those who experienced bullying didn't report their concern. One of the major barriers that had been cited was for not escalating the bullying concern was a lack of confidence in the available processes in the trust where they worked, and they didn't have confidence that he would deal with the behavior that had been escalated. Other things that were cited were fear of repercussion, not being aware of what process to use. 58% of those who reported their experience of bullying, who took put their head above the parapet to report this, actually felt that their concerns were not addressed. Now, in terms of microaggression, 58% of respondents had experienced microaggressions from their colleagues. Micro insults were more represented in free text comments when compared to micro assaults, like comments about their accents, and people felt they were alienated in terms of ward activities, training activities. They were told to kind of knuckle down to do their jobs. Some of the comments were quite harrowing. Sometimes clothing were referred to as being pajamas. Some people felt that fun was being made of the food that they brought to lunch, and a number of very, quite poignant comments were identified in the survey. 74% of respondents also who experienced microaggression did not feel that they had the support of their line manager to challenge those behaviors. In terms of the racist comments, 69% had received racist comments from their patients. 36% of those who experienced racism from patients didn't feel that they had the support of their line manager to challenge those behaviors. So what we have is a running theme of people who have difficult experiences, but felt that they didn't have the support to actually have those behaviors addressed. In terms of impact, 53%, more than half, felt that the discriminatory experiences that they had a negative impact on their mental well-being. About a third actually felt that their negative experiences had an impact on their work performance. What's particularly concerning in this is that there is a stereotype that when you're Black, that you have high tolerance and resilience, you're able to get on with work, but 22% actually felt that the negative experience had an impact on their work performance. And 32%, which is about 1 in 3, had considered leaving their jobs due to the discriminatory behavior that they had experienced. Now, in terms of the conclusion of the survey, what did the survey tell us? What we already have is that we have a lot of quantitative data in terms of people who experience bullying. What did this survey achieve differently? I think it was the free text comments that were invited to try and give a qualitative flavor to some of the experiences that people had, whilst working within the healthcare system. What does it tell us? There's still ongoing experience of workplace discrimination. There have been a number of conversations and a lot of policies and procedures, but what it tells us is that despite the policies and procedures, people day to day still experience ongoing workplace discrimination. Now, what it highlighted as well was the issue about not just individual discrimination, but the structural versus the systemic discrimination that has been highlighted by a number of speakers. People feel that they work in a system where the system doesn't really respond to their concerns, and they had hit so many barriers in trying to get some of the behavior that they have been addressed. And what was quite difficult in trying to analyze the data was almost the sense of learned helplessness. Some of the comments actually said, why would I questioning the rationale for escalating when they did not feel that their concerns would be addressed. Another thing that it highlighted was that the data from the data was that the impact on patient care, the fact that people are thinking about leaving their jobs, the impact on workforce well-being, with about 1 in 3 considering leaving their jobs. That is actually much more concerning considering the gaps that we have in recruitment, and also the fact that the NHS is actually dealing with a big problem with retention, and also the fact that more funding is being asked for in terms of mental health to assure that we have enough professionals to actually respond to patient need. That actually been brought into context with the recent statement from the Royal College trying to advocate for more psychiatrists and actually more mental health staff to be able to cope with the population need, not just for COVID. There had already been a need before COVID. And the last conclusion was the responsibility for caring for professionals. We are from a caring profession and we care for patients. Where is, I think the question is what the responsibility about caring for the professionals. Do we think it's a moral duty due to individual, need to try and make the situation better for your colleague in the workforce, or is it an ethical obligation? We've heard about the race equality standards. We've also heard about, other frameworks that have been put in place to start addressing, race equality and also workplace discrimination. So I just wanted to end with, there was a book that had been released by the Royal College, and it talked about the concept of intelligence kindness. And trying to paraphrase the book talked about intelligent kindness not being the soft, fuzzy feeling, but more the fundamental need to look at problem-solving strategies to try and develop sustained, healthy organizational culture and effective human practice to ensure that individuals, not just individuals, thrive in the organization, but ensure that there is positive organizational behavior. And I think there is a clarion call that was made by, the book is actually by John Barland and colleagues, but there was a review that mentioned something that kind of resonated with what, that the survey was calling about. The quote is from Iona Heath and Hetty Enzing. I hope I pronounced their names right. And it was, I try and paraphrase the two quotes. And what the quote said is, let us make a strong commitment to building intelligent kindness systemically in healthcare organizations, because that will be a driving force and effective strategy for better future for us all. So I think what this survey kind of highlights is that there are differential experiences between different ethnic groups, but this is the first one that has tried to kind of throw a spotlight on Black psychiatrists' experiences in the NHS. But I think from now, the look of people are expecting actions that can filter through to clinicians on ground, and perhaps showing the intelligent kindness as one of the, like the strategies, but actually being aware of it and actually making tangible actions that can filter through to the day-to-day clinician on ground might help change the experiences of the Black psychiatrists. Thank you.
Thank you very much. That was really good. Intelligent kindness. I think we need to hashtag that. It is important to remind all about it.